It may sound like a new Apple product, but IPAB is actually a controversial board at the heart of a highly charged battle over Medicare. It's the Independent Payment Advisory Board. It's tucked into the president's health care law and could have unprecedented authority to make decisions about which costs Medicare will and will not cover. Last week, the House Ways and Means Committee approved a measure that would do away with IPAB. Now, joining us to discuss that are two members of the committee, Republican Erik Paulsen and Democrat Jim McDermott. Thank you both, gentlemen, for joining us.
Good morning.
Thank you.
All right, Congressman McDermott, I want to start with you. I mean, this was approved in the committee by what I understand was a voice vote, so I don't exactly know who was for and against. It wasn't recorded. So what's your position on this repeal?
I'm opposed to repealing it. It is a PR device developed by the Republican Party to create fear about the Affordable Care Act, which is going to be argued in the Supreme Court in about 2 weeks. So they really brought this up. It has no effect for the next 10 years. The CBO has told us that it will have no effect whatsoever until 2022. So there's no pressure here. There's no real problem. Most of what you will hear is really to make voters afraid of the Affordable Care Act. It's not anything to do with the major part of the bill.
And what we're talking about is a board that would be appointed by the president but had to be approved by the Senate, and they would make decisions if Medicare cost overruns hit a certain point. So, Congressman Paulsen, what are your concerns?
Let me correct you.
Oh, okay. Congressman McDermott?
You can't say it would make decisions. It would make recommendations to the Congress. The Congress could vote yes or no. So this idea that we've given away all our control simply is not true.
Okay, but if you don't approve those, the cuts have to come from somewhere. So in some way, those decisions would kick in.
They would kick in if the Congress didn't act. But the Congress is saying we're not able to we can't make decisions. That's why we're afraid of this board doing it for us.
Okay.
That's what the Republicans are saying.
Okay, Congressman Paulsen, this board would have power. So what are your concerns about how that power may be used?
Well, absolutely. This is going to be 15 unelected, unaccountable bureaucrats that will have the authority to deny payments to physicians or care for seniors. This has strong bipartisan support. I do expect, just as it passed in our committee last week, it will as well pass in the House in the near future. You know, the bottom line is here, we need to make sure that we as elected officials are serving our Medicare beneficiaries, those who elect us, rather than giving bureaucrats or unelected bureaucrats the authority to do this, because now we're allowing the government to take the place and step in between a doctor and their patient in that relationship, and we should not be doing that.
Congressman Paulsen, there's a CBO report saying that if you do repeal IPAB, it's going to add a cost of $3.1 billion to the deficit over the next decade. So how do you take care of that? Will there be an offset in the bill? How do you account for that added cost?
There will be an offset that will be included in the bill before we vote on it on the House floor, because that's what the rules do require. We've already repealed some provisions of Obamacare. We've had offsets for that. This will have an offset as well. It might be medical malpractice reform. It may be something else, but we are going to for sure have an offset and do health care in the right way for the patient-centered doctor-patient relationship.
All right, Congressman McDermott, a number of Democrats have signed on in support of this. What do you think ultimately happens when it gets to the House floor?
I think Mr. Paulsen is correct. It may well pass, but it'll die in the Senate because it makes no sense. When you talk about health care reform in this country, you have to talk about two things. One is access and one is controlling costs. This was put in by the Senate because they see it as a reasonable way to control costs in the future in 2022. Remember, this is 2022, 10 years from now. This is going to come into effect. And my view is that you cannot talk honestly with the American people about health care delivery if you do not control the costs. You can't just say we're going to spend everything. We're already spending twice as much as they are spending in France and Switzerland and Germany, and we don't have the health care system that they have. So it's simply got to be done. We have to talk about cost control.
There are a lot of tough decisions along the way. Congressman Paulsen, Congressman McDermott, we will watch this through the House and Senate. Thank you both for your time.
Thank you.
Thank you.
How could I justify